Many people believe that having sex during a period is a surefire way to prevent pregnancy. This belief stems from the idea that ovulation, the time when an egg is released from the ovary, occurs mid-cycle, and thus, the days of menstruation are considered safe. However, the human body is complex, and menstrual cycles can vary greatly from person to person. While it's true that the chances are lower, it's not impossible to get pregnant during this time. Sperm can live inside the female reproductive tract for up to 5 days. If you have a shorter cycle or irregular periods, ovulation could occur soon after your period ends, making it possible for sperm to meet an egg. It's crucial to understand the facts about your menstrual cycle and how pregnancy can occur to make informed decisions about your sexual health. Knowing the timing of ovulation and the lifespan of sperm can help you better understand your fertility window. Additionally, factors like stress, illness, and lifestyle changes can affect your cycle, making it unpredictable at times. This essay will explore the ins and outs of period sex and pregnancy, debunk common myths, and empower you with the knowledge to make safe and healthy choices. We'll discuss how hormonal fluctuations can impact your cycle, the role of contraceptives, and the importance of communication with your partner about sexual health. Remember, knowledge is power, especially when it comes to your body. By understanding your menstrual cycle and the factors that influence it, you can take control of your reproductive health and make informed decisions that are right for you. Stay tuned as we dive deeper into this important topic. Your menstrual cycle is like a monthly clock your body follows. This cycle is a natural process that prepares your body for the possibility of pregnancy each month. Understanding how it works can help you manage your health better and recognize any potential issues early on. It starts with the first day of your period and ends the day before your next period begins. This entire cycle is controlled by a complex interaction of hormones, which regulate the different phases of the cycle. The average cycle lasts about 28 days, but it can vary from person to person. Some women may have shorter cycles of around 21 days, while others may have longer cycles lasting up to 35 days. It's important to know what's normal for you. During your cycle, your body goes through different phases to prepare for a possible pregnancy. These phases include the menstrual phase, the follicular phase, ovulation, and the luteal phase. Each phase has its own unique characteristics and hormonal changes. One important phase is ovulation, when an egg is released from your ovary. This is the time when you are most fertile and have the highest chance of becoming pregnant if you have unprotected sex. This usually happens around day 14 of a 28-day cycle, but it can vary. Some women may ovulate earlier or later depending on the length of their cycle. Tracking your cycle can help you understand your own pattern and identify your fertile window. While less likely, pregnancy during your period is possible. Sperm can live inside the female body for up to 5 days. If you have sex towards the end of your period and ovulate early, sperm could still be alive to fertilize the egg. Irregular cycles can also increase the risk. If your periods are unpredictable, you might ovulate earlier than expected, even during or shortly after your period. This means you could be fertile without realizing it. Section 4. Debunking period myths. What you need to know. Many myths surround period sex and pregnancy. One common myth is that sperm can't survive in period blood. This is false, as sperm can survive in the vagina for several days, regardless of the presence of menstrual blood. Another myth is that periods are always regular, so you always know when you're ovulating. However, many factors can affect your cycle, including stress, diet, and certain medical conditions. Section 5. Staying safe. Tips for period sex. If you choose to be sexually active during your period, practicing safe sex is crucial. Condoms are the most effective way to prevent pregnancy and protect against sexually transmitted infections or STIs. Using condoms consistently and correctly every time you have sex is essential. Don't solely rely on the rhythm method or withdrawal, as they are not reliable methods of contraception. Section 6. Your body, your rules. Taking control of your sexual health. Understanding your body and menstrual cycle is vital for your overall health and well-being. Track your cycle using a calendar or app to become more aware of your body's patterns. Don't hesitate to talk to your healthcare provider about any questions or concerns regarding your menstrual cycle, contraception, or sexual health. They can provide personalized advice and guidance. Section 7. The last word on periods and pregnancy. While the likelihood of getting pregnant on your period is lower than at other times of your cycle, it's not impossible. This is because sperm can survive in the female reproductive system for up to 5 days. If you have a shorter menstrual cycle, ovulation could occur soon after your period ends, increasing the chances of sperm meeting an egg. Understanding the nuances of your cycle can help you make more informed decisions about your sexual health. Sperm can live for several days, and irregular cycles can make ovulation unpredictable. This unpredictability means that even if you think you're safe during your period, there's still a risk. Tracking your cycle can be a useful tool, but it's not foolproof. Irregular periods can be caused by various factors such as stress, diet, and underlying health conditions, making it even more challenging to predict ovulation accurately. Always prioritize safe sex practices by using condoms consistently and correctly. Condoms are the only form of contraception that also protect against sexually transmitted infections, STIs. It's essential to use them every time you have sex, regardless of where you are in your menstrual cycle. Remember, knowledge is power. Educating yourself about your body and how it works can empower you to make choices that are best for your health and well-being. By understanding your body and taking charge of your sexual health, you can make informed decisions that align with your needs and desires. This includes knowing the different types of contraception available and how they work, as well as being aware of the signs of ovulation and how to track your cycle. Empowerment comes from knowledge, and by educating yourself, you can take control of your reproductive health and make choices that support your overall well-being.